Welcome to this session, and thank you, Madam Chair. I stand on all existing protocols. My name is Helen Ekpo. I'm from Akwa Ibom State in Nigeria. That's the south Nigeria, where you have the oil. That's what they know us for. Well, I presently work for the Palladium Group of companies in Nigeria. Palladium is a United States-based international organization that is being funded by the USAID to run this project called Health Policy Plus Project, which I'm going to talk about. And in that organization, I'm the Capacity Development Advisor. My work is to look at the systems in all levels in the state I'm assigned to, and to try to strengthen systems for improved health. Except you want to ask me specific questions, I'd like to stop there about myself. Is that okay? Good. Thank you. So my presentation is on strengthening capacities of the ward development committees to promote health in Alewodo ward in Osun State. Now, Osun State is one of the southwestern states in Nigeria. It's, bordered by Kwara, Oyo, Ondo, and Ogun states. These are all southwestern states. But I just want to talk about that the Alekuwodo ward is a small community, very rural community that is inside Osun State. Okay. Sorry, I wanted to use the pointer. First one. Is the first to show you. Well, it's somewhere, if you look at that map, you will see Osogbo right in the center. It's colored yellow there. So, the pointer was working just now. And in Osogbo, that's the local government area. Thank you. That's the local government, and it's the capital city of Osun State. And you have the Alekuwodo ward, which is a very rural community that is right inside that community. And the health indices of Osun State, and even that of Alekuwodo is contributing to the health indices in Osun State, is very poor. And infant mortality, you can see, is 78%, 78 per 1,000 live birth. Children under 5 mortality rate is quite high. We have 101, per year. Maternal mortality rate is equally high.
Yes, first one.
The first one. Thank you.
Yes.
Okay. Thank you. So I was trying to point to you where you have the Alekuwodo ward, just here in Osogbo. And this is Osun State map, where we work. Up north here, you have Kwara State borders up north here. You have Oyo by the west, and then you have Ondo and Ogun State is bordering them by the south there, Ondo by the east. That's about Alekuwodo. I've talked about the poor health indices, and I've also, the primary healthcare facility that is based in Alekuwodo ward is very, very dilapidated. It's, almost there are no furnitures, electricity, water supply is bad, and then poor sanitation. We've been talking about this since yesterday. We've been looking at the issue of human resource for health in primary healthcare setting. It's also poor. And then the residents, people in Alekuwodo ward have to, patronize private health facilities, which is what we've been talking about. Patronizing private health facilities is not that bad, but it is bad in the sense that, poor people not having so much money, having to, patronize these hospitals in order to get health care. Now, I'll tell you a story of this, our border, we call them Okada man in Nigeria. This Okada man has a wife, and the wife got pregnant and was going to deliver by CS. They don't have any money, very poor. I'm painting a picture of the typical Nigerian community where you have, most people are very poor there. And Madam had to be taken on the CS, and the husband had to rush everywhere to gather all the money he has to pay for the service. He ended up having to sell his boda just to be able to pay for the wife to deliver in a private health facility. And then having paid the money, the wife delivered safely, and they went home. After that, so what? There was no more boda for him to use for service. This situation got them much more impoverished than where they were coming from. And so, looking at all this situation, that was what led the government in Nigeria to buy into this universal health coverage, program that is ongoing globally. And in 2014, Nigeria actually signed our own National Health Act into law in 2014. And so, signaling Nigeria's commitment to achieving the universal healthcare as mandated by the law, the Basic Healthcare Provision Fund, which is a large-scale reform intended to increase resources for health and extend primary healthcare services to all Nigerians through the provision of basic minimum of health services package, or basic minimum package of health services and emergency treatment, was then instituted. And so the government of Osun actually bought into the idea, and in doing that, let me first of all maybe I should talk about some things before I move on, just for clarity. Now, the basic minimum package of health services is just a few services that are already being rendered in the primary health care, which the government is now saying that those services need to be free. Things like immunization for children under 5, ANC for nursing for pregnant women. We have treatment for malaria. So they looked at some of the major problems that we have in Nigeria, and they used those major services as the basic minimum package of services, so that these services, when they are provided to everybody, they can have access to it at no cost. Now, the Basic Healthcare Provision Fund is financed by, number one, funds from our federal government, that is from the consolidated federal revenue. So what happens is that the whole fund from the government, 1% is allocated to our Basic Healthcare Provision Fund. And the government also mandates that each state government will have to put in some counterpart funding, which is pulled in as a pool to provide those basic minimum package of health services. And then we also have financing coming from grants from international donors. We have Bill and Melinda Gates Foundation, over $90 million is being put in. So much from USAID. USAID is helping the country in terms of capacity development, which I'm also part of. So what approach did we use, excuse me, to improve the health status of its people and to increase access to quality care? The Osun State government in 2018 fulfilled conditions for eligibility for the Basic Healthcare Provision Fund. So what they did was that they paid a sum of 100 million into the account, which enabled them to start assessing the 1% revenue from the government. And then I also state here that the Basic Healthcare Provision Fund represents a significant step towards revitalizing and strengthening our PHC delivery services in Nigeria. So we already have PHC system working in Nigeria, but we know the issues, I've mentioned them before. The issues there are still that some of them are dilapidated, few health workers and all that. So with this BHCPF, with the Basic Healthcare Provision Fund, government is now, putting on more resources into primary healthcare. So what happens? The picture is this. When people come enroll for the Basic Healthcare Fund program, which is like a social service, social insurance program, they get treated for free at that primary healthcare. And then the primary healthcare service provider, they fill forms, they fill their claims form, which government actually pays back to them. And that money is again pulled back to, take care of the facility and continue to provide quality services. Because like Prof talked about this morning, UHC is nothing without quality of service or improved quality of services. Now, with the technical assistance from the United States Agency for International Development, USAID, supported project L Policy Plus, Osun State government commenced implementation of the Basic Health Provision Fund in 10 local governments, health authorities, 115 health facilities and wards, including this Alekuwodo ward we're talking about. In getting this thing done, we needed to make sure that every player, each partner, every stakeholder in the Basic Healthcare Provision Fund actually understands their roles and responsibility. They understand what universal healthcare coverage is all about. They understand the guideline for how this fund will be managed. So we had to help the state. We had to help government partners and the other stakeholders in the state to get to understand what the Basic Healthcare Provision Fund is all about and what universal healthcare coverage is all about. And what we did was to support them. How did we do this? We did a lot of assessments. We did a lot of looking at what is on ground in the system currently. One big thing that we did with the collaborating ministries, which are the National Health Insurance Scheme, we have that. We have the National Primary Healthcare Development Agency, and then we have the Federal Ministry of Health, which is like the coordinating body, managing this fund. So what we did with them was to look at how do we move on. So we had a lot of sensitization meetings. We had a lot of assessments, assessing various levels of partners to see what is their capacity to implement this Basic Healthcare Provision Fund. So we had assessing the quality standards even in our primary healthcare to see where they are. Can they provide services? What are the challenges and all that? And as we looked at each of their capacities, we were able to come up with improvement plans for each of the levels. We also assessed the WDC. When I say ward development committees are just local members that are working very closely with the health facilities to make sure that they mobilize resources to support their health facilities to continue to provide services. So we did various levels of assessment. If my colleague was here, the Hadley Peter, he would have presented the results we had in terms of the assessment we did with the WDC members. So we did those assessments, and like I said, we developed plans. We supported the various ministries to develop curriculums for training each levels of the stakeholders so that they can understand their roles and responsibilities in delivering the Basic Healthcare Provision Fund program. And then we did a lot of training. So we had this training for the ward development committees. These are very local people that can't even speak English. We had trainings in our local dialect just so to ensure that they could understand what we're talking about. And then we explained to them everything that they were supposed to do in terms of, their roles in mobilizing local resources to improve health. What were the results? This was very amazing for us. Immediately after that training, the WDC members that participated in the workshops, met with their PHC staff. They would usually have these meetings with them, but at a time, it's no longer regular because the WDC became like politicians. They are also like politicians in the community. And so because if one ruling party, people in the PHC are not members of your ruling party, you might not want to relate with them. But that training helped clear a lot of all those issues, just to make sure that we're talking about the health of your people. And if you want to win political scores, you have to support the health of your people. It changed a lot of mindset for the WDC. And you have them, they sat down with the health workers, they looked at their plans that, so these are the problems we've been having. For instance, one of the problems that they immediately identified was that they did not have electricity in that facility for like 4 years before that training. And 3 days after they had that meeting, they mobilized some influential people in their community. They went to meet with the electricity officials, and in no due time, electricity was restored in the community. Like I said here, 3 days after the training, electricity was restored. And you can imagine what electricity can do. All the fridges that were not working started working. Water that is related to pumping machine and all that started working. So you have the facility staff started providing quality services as a result of that. So lessons here is that strengthening capacities of the staff of facilities and the ward development committees on their roles and responsibilities fosters better relationship with the community and facilities for improved quality of services for the community levels. Communities are poised to be part of development efforts if they are involved in the planning, implementation, and mobilization of resources for improved health services as demonstrated by the Alekuwodo Ward Development Committee. And lastly, this addresses the policy and systems development for UHC partnership as community committees were engaged to mobilize local resources to address health issues and contribute to the implementation of our National Health Act. Thank you very much. I would like to stop there with this picture that is just showing immediately after the meeting, the ward committee member trying to engage all the community that this is the problem we're facing and this is what we need to do. And I'm bringing you greetings from the team in Osun State that did this work. Thank you.